Diarrhea is a very common problem. This happens to everyone at least once or twice in a year. In most of the cases, we take antibiotics to cure diarrhea. But what if I tell you that in many of the cases, or rather more than 80% of the cases, you don't require antibiotics? Rather, use of antibiotics or excess use of antibiotics in diarrhea might cause harm to your gut health, also will make you more susceptible to increased or frequent stomach infections or diarrhea. Now, one might ask, if antibiotics are not of any help, then what should we do to cure diarrhea? Is there any gut-friendly, effective way of managing diarrhea? Are there any home remedies, or are these home remedies equally effective compared to medicines? What are the most effective home remedies for getting treated with diarrhea? What should we eat? What should we avoid so that our gut will not get harmed? In today's video, you are going to get answers of all these questions related to diarrhea. You are going to get a whole lot of information, the new information which probably you have never heard of. Also, in the end of this video, I am going to discuss with you a very interesting yet dangerous fact about antibiotics use. So stay with us, keep watching this video very attentively till the end. Friends, diarrhea is a very disabling, very embarrassing situation. Imagine you are up for a very important meeting, you're preparing for a very important interview, or you have planned a very nice proposal for your loved one. But just a day earlier, you got diarrhea. Now, this is an awful situation, and many of us might have already faced it. I have known a couple of people who have faced this kind of situation, and for none of them, this has turned out well. But this can happen to any one of us. So, what should we do? First and foremost tip or advice from my side is never force yourself to attend something that important if you are having diarrhea. Tell them honestly what you are going through. Trust me, they will understand because this is a situation which most of us go through in our life. Recover fast, reschedule faster. This is the only way around. Second, have good knowledge about diarrhea and start taking the right steps immediately after you experience the first symptom to manage diarrhea. Having said that, I want you to forget everything that you have known till date about diarrhea because I'm going to give you some new perspective, probably the kind of information you have never heard of. So let's begin. So what is diarrhea? Diarrhea is passing of loose stools or watery stools with an urgency of making bowel movement multiple times a day. Mostly these are associated with other symptoms like nausea, abdominal pain, crampings, bloating, dehydration, large volume of foul smelling stool, sometimes greenish or blackish stools or reddish in color. Diarrheas are mostly of two types. Acute diarrhea, which is lasting for about 2 to 4 days, might be due to infections, food allergies, or intolerances as a result of medical side effects or side effects of some medicines. I'm sure many of you would have observed that certain antibiotics like azithromycin, amoxicillin can cause loose stools. Second category is persistent diarrhea, which lasts for about 2 to 4 weeks. Third category is chronic diarrhea lasting for more than 4 weeks. Probable causes are inflammatory bowel diseases, irritable bowel syndrome, small intestinal conditions, or surgeries like bariatric surgery, gallbladder surgery, colorectal resection, etc. Diarrheas are usually simple diseases which can be managed easily with medicines or home remedies, but sometimes either due to delay in seeking treatment or underlying causes, it might lead to complications like severe dehydration, metabolic derangements or acidosis, impaired consciousness, circulatory shock, acute renal failure, malabsorption syndrome, etc. So it's very important to take few steps immediately after you experience the first symptom of diarrhea. So what should we do? Let's discuss super effective tips to cure diarrhea super fast at home one by one. Tip number 1. Keep yourself well hydrated. Diarrhea leads to water and electrolyte loss from the body leading to dehydration. Reduced oral intake further worsen this situation. Hence, one must make sure to keep sipping liquids, be it plain water, buttermilk, ORS solutions, fruit juices to keep up for the water loss. This would prevent 90% of the complications related to diarrhea. Also ensures faster recovery. Now, few best drink which I would suggest or advise are buttermilk with ginger or cumin water. But remember to avoid consuming caffeinated drinks like tea, coffee, beverages and milk or milk products. Now moving to tip number 2, Consume pre and probiotics. Probiotics are the food items that increases good bacteria in our gut. Prebiotic are food items that act as food for good bacteria, indirectly helping them to grow well. Healthy gut bacteria will let outnumber the bad bacteria, improve gut health and aid in gut healing. Hence, will help to control diarrhea symptoms quickly. Some examples of probiotics are fermented food like idli, dhokla, etc., curd or Greek yogurt, cheese, kimchi, dark chocolate, etc. Some examples of prebiotic are banana, barley, garlic, onion, apple, wheat bran, etc. Curd rice would be one of the greatest options. Tip number 3. Food that are easy to digest and support early healing. These are mashed bananas with some ghee, white rice with ghee or curd, apple, toast, slightly burnt toast rather, khichdi, baked or boiled potatoes, oatmeal, chicken soup. You should eat the food items in little quantity and increased frequency. Tip number 4. You must avoid following food items. These are the food items which are either difficult to digest or have gut irritating abilities and they might interfere with gut healing. List is as follows. Spicy food, fried food, sugary food with artificial sweetener. As we already know that few artificial sweetener have mild laxative property. High fiber food which may put digestive system in hyperactive state. Also processed and packaged meat or food. Legumes like rajma, chana or milk products. Cruciferous family vegetables as they form gas in intestine. Nuts, raw vegetables, fruits like papaya or mango. Now, if you will start following all these steps from day 1, you will recover within 2 to 3 days or 2 to 4 days. But in some cases, these steps might not be enough to take care of your diarrhea. So, what should you do? Then, if you see any of these red flag signs, you should immediately consult a physician or a doctor. What are these red flag signs for diarrhea? Number 1, when stools are black or bloody. Number 2, severe abdominal pain. Number 3, fever more than 100 degree Fahrenheit. Number 4, signs of dehydration like yellowish urine, cracked lips, dry mouth, rough and dry skin, sunken eyeball, low BP, etc. And number 5, diarrhea more than 2 to 4 days. Now, the time for star question of this video. Do we really need antibiotics in cases of diarrhea? The answer is no. See, antibiotics are useful only in the cases of diarrhea where bacteria is the infective agent, which we know that in most of the cases, probably in less than 20% cases only, bacteria are the causative agents. So for rest 80% of the cases, antibiotics are not going to help. They are of no use. But what is the harm of using antibiotics? Is it that bad? Yes, probably it is. Antibiotics unintentionally also kills healthy and friendly gut bacteria which in long term affect gut immunity. This means antibiotic use make our gut more vulnerable to frequent gut infections. You'll be surprised to know that it takes almost 4 weeks for your gut to recover from one course of antibiotics. Also, in a study, it was concluded that those who take frequent antibiotics have higher chances of getting inflammatory bowel disease, which is a cause of chronic diarrhea. Moreover, rampant use of antibiotics also increase chances of resistant variety of common bacteria. The new fancy word for such bacteria is superbugs, which are nightmare for doctors. So it's a sincere request to all the viewers of My Expert Doctor, please do not take antibiotics unnecessarily. And a request to our pharma friends, antibiotics are not over-the-counter drugs, so don't give them to people without a valid prescription. This way we can improve our gut flora, reduce incidences of bad diarrhea and also prevent antibiotic resistance. Remember, antibiotic is a double-edged sword. If you will not use it rightly in a correct way, it is going to harm you. So this is it. Thank you for watching this video so patiently. I hope you have understood everything about diarrhea. I have given you every bit of information. But if something is remaining, something is bothering you, drop a comment in the comment box. I'll try my best to solve your query. If you like the information, give us a thumbs up, like this video, share this video with your friends and family. And for some reason, if you haven't subscribed to our channel yet, show us your support, we need it. Subscribe this channel and hit the bell icon so that you will get the notifications of our healthy content. So that's all for today. We'll see each other again with similar healthy content. Till then, stay healthy, stay happy.